All right, so let's get started with our program. Our first speaker is Mayor Mike Antonovich of the LA County Board of Supervisors.
Thank you, Carolyn. To give you first the good news, this is finished 9 months ahead of time and nearly $1 million in savings. So, team here, thank you for that. This past week, as you know, the Daily News had a front page story on the devastating earthquake that hit this area, this community. And it was one that destroyed this hospital. And this hospital, after that earthquake, year after year, remained a rusted silhouette in the sunset that you would see as you pass along the 210. And it was very interesting because in 1980, when I ran for the Board of Supervisors, everyone said you could not rebuild this facility. It had to remain status quo. And I made this an issue that it could be rebuilt if it took a good team, partnerships, public-private partnerships, working with the community, working with the state and federal government. We could do what those status quos had said and stated, even in debates that we would have, because Mr. Ward and I had about 40 debates across this area, that it could be rebuilt. And I'm proud to say that in 1981, Marcia Ney, who was my health deputy at the time, and she passed away a few years ago, along with the community, we had a communities group in Sylmar. Sam Cordova was the chair of that. Working together, and then with the County Department of Health, with the state, and at the federal government, little did I know at the time, but President Ronald Reagan had a direct interest in this facility as well to ensure that FEMA, which they said FEMA could never deal with the various issues here, the complexities, the necessary funding, et cetera. And again, we had to keep this status quo. Had Ed Meese and his deputy, Admiral Garrick, who lived in the San Gabriel Valley, assigned to see how we could maneuver at the federal level. And so putting a public-private partnership together, we're very pleased to be here in 1987 when we opened the facility to once again serve this community. But it's not just this community. We're also talking about Santa Clarita and the Antelope Valleys as well. And then in 2002, because of the needs assessment, there was a need. The population continued to grow. We did the needs study that indicated that what we had to have built is what we're doing today in this dedication. So like a phoenix rising from the ashes, Olive View is one of the prime healthcare crown jewels of our county health network. So what we have today is March 6th, the opening of the emergency, which is a $53 million, 31,000 square foot facility. It's going to have an emergency room and acute care, which is twice the size, over twice the size of the former unit. It's going to have 20 general treatment rooms, 2 procedure rooms for the sickest, and 5 OB/GYN exam rooms, 6 isolation rooms for treating patients with infectious diseases, 9 urgent care treatment centers, and center observation bays. And now to reduce this wait time for the patients, we're also going to have transportation between the facilities to the new emergency room, which will also include a central radiological suite that provides x-rays, ultrasound, and CT technology. The new acute care unit in May will be opening. So you have a March opening and then in May. And this will open a new inpatient unit to treat long-term infectious disease patients, including TB. And due to the anthrax scare earlier in this decade, the county has been identified as having insufficient isolation capacity in case of a potential biochemical event. And the new 11,000 square foot unit will treat up to 15 long-term infectious disease patients requiring isolation. And the unit will also accept patients from other parts throughout the county of Los Angeles. So again, as I said, the good news, it was done 9 months earlier and nearly $1 million less in costs. But again, it was a hard work and close collaboration. And we, as was mentioned once again, we have those individuals here from the Department of Public Works, McCarthy Building Companies, Langdon Wilson Architects, and the Olive View Medical Center. They were all there. Supervisor Yaroslavsky was not there at the time, but after he became a member of a board of supervisors, he also helped us with Olive View Hospital relative to the various budget issues and procedures that we had to go through as well. So again, it was a partnership, public-private partnership, and what we took was from the bad to building something for the good to serve the community of the whole. And it's a good teamwork effort. And if we could have more public-private partnerships throughout our county, state, and nation, we could achieve many more of the impossible, which people say is impossible, but really is possible.